courses this year has been slightly different. We wanted this to be more interactive. We wanted more cases, more Q&As, and we really wanted this to be like for people that attended to be educational. And I think one of the most important highlights of these different topics on the CMEs have been this interaction between the person giving the speech and the audience. And there are some interesting new topics on artificial intelligence, for example. So there were some sort of interaction because they did at the last minute, they did some Q&As, but they were not actually Q&As. They were them telling us how to interpret some things that we see in the clinical papers and so on. So that was a very interesting one. And onconephrologists, for example, which is also brand new CME, very well attended. They were also interacting about the differences treating and dealing with medications in the new onconephrology department, or how to do an onconephrology consultation or outpatient clinic, which is a very important topic because we are more and more increasing the number of onconephrology departments or units in all European countries. CME1, CME2, which are and CME3, which are transplantation, glomerulonephritis, and cardiovascular diseases. And in the last years, cardio, kidney, metabolic diseases have experienced a very much increase of medication or new drugs and new medications that are extrapolating to all areas of nephrology. And of course, we have also the classical like CKD, MBD, and nephrolithiasis, and genetic for nephrologists. Also genetic for nephrologists, very interesting. This is new for most of us. And they exactly did what it was supposed to do. They start from the beginning. So as everyone that doesn't know a lot about genetics can just take advantage of all the new things, polygenic risk score and ApoL1 and so on, that can enhance the ability that we have to better assess, to better diagnose all these genetic diseases that were like in the, in the middle of nowhere. And there are lots of young people in dialysis or transplanted that didn't have a proper genetic testing at the beginning. So I think we have addressed like many things, and very important as well, how to interpret biopsy, renal biopsy. We have a brand new CME number 10, a brand new CME about how to do things from the pathology point of view, and renal pathologists are interacting with us nephrologists so as we can just understand a lot more better how to do, how to interpret, or how to address the renal biopsy findings. Well, I think I would say just a little bit about that. We will check what happens to this ERA 2025. That's very important for us to have like an interact with all the audience. Everything you say, we will take a look at that. We will check it out. And if there's something we need to address to enhance, to get better, then be sure that we will do it. But from now to the next year, we want to do even more interaction with the audience, more polls, more Q&As, to be clear that this is educational. So go and learn what you don't do in your clinical practice, in your everyday practice. So we want you to sit down, to enjoy, to learn, and to interact with those experts that you sometimes don't have the ability to clearly go and say what to do with this, what to do with that. So that's exactly what we want. We want even more interaction between the audience and the experts.